Sean Hall. I am the president and founder of the Life and Breath Foundation. We're very happy to present our speaker series continuation from 2020 into 2021. Tonight's topic is going to be breathing exercises for sarcoidosis patients. We think it's a very timely subject, especially with all that we're going through, handling the COVID situation, and as well as just our normal health concerns. A little bit about the Life and Breath Foundation. The foundation was founded in memory of my mother, Ida Hall, who had sarcoidosis and unfortunately lost her battle in 1996. The organization has been in existence for 22 years. We continue to raise the awareness, look for research opportunities for us to find a cure, but more importantly, we're also positioning our focus to help those who are affected and have to manage the disease. So we think offering the sarcoidosis community effective tools to track their journey, decipher medical issues, and maximize their quality life is one of our primary goals, as well as to provide a nurturing environment for those affected by sarcoidosis to share their experiences in this atmosphere to be able to help others. And then lastly, to build more awareness within the medical community to help combat this chronic disease. So as you or patients interact with medical professionals, we want to make sure there's a more balanced bridge that allows communication, transparency to occur. Tonight, we are happy to partner with the BreatheFit team. BreatheFit is based out of Houston, Texas, and was created by respiratory therapists and personal fitness trainers. The amalgam of knowledge forged a new platform to bring basic breathing with resistance training, resulting in performance breathing. Their methodologies break the mold of typical exercise to meet the body's demands for needed conditioning. The outcomes of higher endurance, stamina, strength, and control has made BreatheFit revolutionary to fitness. This is something that we think is timely. It's something that we want to share nationwide with our audience and community, and we're happy to do that. Just a little bit on the agenda this evening. Again, please make sure that you're on mute and to eliminate the background. We want to take questions. We'd like for you to put those questions in the chat feature, which we'll handle at the end of the presentation. But we want an interaction with you. We want to make this a worthwhile experience for you. More importantly, we want to help answer any questions, comments that you may have. So one to-do list, if you have a drinking straw and it's available, put that close by you, because we're going to be utilizing that as we go through BreatheFit Basics, Diaphragmatic breathing with Coach Ciro, where we'll go through mechanics, inhalation, exhalation optimization, flow, and volume optimization. Our next coach, Harry, will then go through a preload maneuver, coordinating to maximize O2, picking up and object, seated upright position, and integrate during exercise, And the last, our straw exercise practice will actually be directed by Coach Mel. Without further ado, I'd like to introduce you to our BreatheFit partners.
Good evening, everybody. Hi, thank you, Sean, and thank you, Life and Breath Foundation. We are honored to be part of this, and more importantly, hopefully we create some value for everybody, and more importantly, again, make you breathe a little easier. So a little background on BreatheFit. We started with a pulmonary rehab background and kind of meshed it with a fitness background, utilizing the best of both worlds and providing something so unique that we could help people from anywhere from the athletic area or chronic disease and anywhere in between to breathe a little bit better. What's more important, we believe in what we call practical tactical. The things that we teach are things that you can do every day, but it's progressive. It helps you breathe better and gets you more and more efficacy in getting more air in your lungs. Just like Sean was saying earlier, please have those questions ready towards the end of the presentation. We are here to help answer them. We're going to begin here with Coach Ciro.
Hello, everybody. This is Ciro, and today I would like to show you the proper way to breathe. Many times we hear about diaphragmatic breathing, but how is it done, okay? We hear from your diaphragm, blah, 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 but it's, unless somebody coaches you or teach you how, it's hard to pick it up. So I would like to do something with you. If you can come with me and follow me quick, we're gonna try to take the deepest breath that you can at the count of 3. Are you ready? All right. 1, 2, 3, go. In, all the way, all the way, all the way. And let it out. Okay, one more time. 1, 2, 3, go. And let it out. Okay. Problem is that many times what we see is an elevation of our shoulders, popping out the chest, but not necessarily using the diaphragm. So you will see a lot of, okay, or like this, all right? So today I would like to redirect the way that you breathe, all right? So focus on this area, and we're gonna focus now on expansion rather than popping out. Keep your shoulders relaxed, down, slightly back, your back straight, and put your hands like this on your chest, all right? Touching your fingers together. Now you're gonna breathe into your nose, slowly, deeply, to the point when those fingers start opening up. You wanna have an inch to an inch distance between your fingers when you breathe in, okay? Try with me. Ready? Touching your fingers, breathe in. And out through your mouth. Breathe in, breathe out. Now, this is the important part. Move your hands on your diaphragm area. Do the same. Breathe out. One more time. Breathe in as deep as you can. And look, those fingers separating, and breathe out. Okay? Once you make the emphasis on expansion rather than popping or lifting, you start breathing better. Okay? Remember to breathe into the nose. A lot of people out there are mouth breathers. No, no, no. You lose all the benefits of your nose, filtering, humidifying, warming up that air, and many other benefits. We need to breathe in the nose. Now, sometimes it's okay to breathe out through the nose, especially when you are performing physical activity. Try to do it through your mouth. That takes us to the next basic exercise, pursed lip breathing. The benefit of this one, once you understand how to expand and how to use your diaphragm, it's very, very important to keep your ratios. When it comes to ventilation, a lot of people focus only on absorbing oxygen, forgetting that we need to take out CO2, carbon dioxide. It's a cycle. In goes the oxygen, out goes the CO2, right? So as you breathe into the nose, getting all those benefits, take your time to breathe out also. Now, the ratio that we're gonna be following is 1 to 2 or 1 to 3, meaning the way out always takes longer. So breathe in, let's say 2 seconds, and then focus on breathing out 4 seconds, okay? Ready? Breathe in. Now breathe out. There we go. Now we're removing CO2. We're avoiding our blood to become acidic. That triggers even more shortness of breath, okay? For you that you guys that like to go to internet, look into the relationship, the homeostasis levels between oxygen and CO2 and how you can control those things by just breathing differently, okay? You can activate part of your automatic nerve system in order to control that balance, all right? One more thing. Breathing through physical activity, all right? It's very important to keep pursed lip breathing at this point. When you use pursed lip breathing, remember to do this. Breathe in, not all the way in. It's going to be very, very hard. You're going to get short of breath if you try to do so, okay? So the way we breathe in, imagine you pulling out bread out of the oven. That's my favorite analogy, I guess. So you want to take a nice deep breath, smell the breath, and then the way out, you're going to purse your lips and you're going to blow as you're blowing candles. So breathe in, nice and deep, and by pursing your lips, you're reducing and creating resistance on the way out that opens your airways too. All right? So one more time, into the nose, out through pursed lips, and this is the breathing you want to keep every time you perform any type of physical activity. I hope these examples and this will help you to perform better when you exercise or when you do daily activities.
So hi, everybody. My name is Harry. Thank you for joining us tonight. So you've heard a lot about breathing, and I know some of you are probably thinking that, we breathe every day. Yes, we do. But the first thing we begin doing is reteaching you how to breathe properly. So how does that work with real world situations? Well, I'm here to show you that. We call it the preload, and there's nothing complicated about it. Just like the name sounds, you're preloading your breath for any kind of exertion you're about to do. For example, I've got a bench here with a simple kettlebell. All too often when we're training people, we see people hold their breath the entire time, and that could be, you could not do anything worse than that. But the preload is preparing your body for any kind of exertion. So I preload by merely breathing in deeply through the nose, like Cyril demonstrated. See me reaching down for the kettlebell. I don't hold my breath, even though I'm talking. So we preload. And on the exertion, we exhale. Whether you're putting it down, lifting it up, preload. Simple as that. Now, two other more practical examples on how to use breathing with everyday usage. A very common thing, you're sitting down. Some people that may have difficulty breathing, the act of sitting up is the hardest thing to do. So, as you can see right here, I'll show from two different angles. Preload, hands right here or hands on the thighs. Exhale, always exhale when you exert the energy. Of course, I'm slightly over-exaggerating the inhale and exhale, just so you can hear it. So, side view. Preload. Hands here. Exhale. And just like that. So, these are very basic things, but this is just the tip of the iceberg on what we can show, teach, and train everybody how to do. So, I hope you found this very helpful. I'm going to turn it back over to Mel.
Well, so far, as you can see, it is a lot. This goes back to the practical, tactical we mentioned earlier. So a lot of things that we've discussed is how these two things work together. And I'm going to warn you now, and I think Sean told everybody earlier, have a drinking straw ready. So if you have it in front of you, kind of wave in front of the screen for me. Come on, you can do that. That's not part of the exercise, but I'm just saying. But anyway, wave it around. Very couple of minutes here. Let me go further of what we just discussed. So Cyril talked about the process of deep breathing. And again, the essence of this is trying to keep the upper body quiet. The idea is you want to fill your lungs. When we say fill the lungs, it is trying to fill from the bottom up. We really want to enhance the expansion of that lower part of your lung. Now, by doing that, this blends into exactly what Coach Harry was saying. So as you learn to do that deep breath, this is your preload. We emphasize the preload in everyday life. Think about it. When you bend over and pick up something, how many times do we get short of breath or lightheaded? A lot of times, if you take that preload prior to that drop and bending over that activity, you will be less, if not better than you were. Another good thing, every day, climbing stairs, walking, doing anything with, like Harry said again, exertion. Be mindful, be intentional of stopping, taking a deep breath prior to that activity. You will feel better. Now, the fun part, okay? So this is the performance breathing of what we do. And the performance breathing of what we do is, and again, it's a straw. So this straw here, and it doesn't matter if it's a bendy straw or whatnot, but it is a straw. So we're going to blend everything we learned together. And here's the exercise. You're going to follow along with me. We're going to do what Coach Ciro said. Coach Ciro said, number one, take that deep breath in. So let's practice that first. Are y'all ready? Take that deep breath in. And then let it all out. Now, here's the challenging part. Straw in the mouth. Everybody put their straw in the mouth. Y'all ready? Okay, I see y'all. Y'all are doing good. When you take that straw in, this is going to be tough. I want you to count at the same time as you're breathing in. Let me do it first so you can see what I'm doing. You ready? Here we go. In through the mouth and listen and watch. It goes 1, 2, 3, 4. And what I'm doing, I'm holding my breath for every count. So I'm basically building on that inside of that breath. And that's important. Let me do it again. Take a deep breath in. Let it all go. Exhale, exhale, exhale. Let it all go. Straw in the mouth and start counting. 1, 2, 3, 4, 5, 6, 7, 8, 9, until you cannot go any further. All right, everybody together. Here we go.
And real quick, Bill,
Yes.
real quick, for anybody that's watching this on gallery view, we have a lot of people on tonight. If you want to see Mel full screen, make sure you go up to view and then click on speaker view, and then you'll get to see Mel full screen so you can see the detail.
And an ugly face. But, but let's try this again. Okay, here it is. Y'all ready? Here we go. Watch with me. Empty your lungs. Empty it all out. Exhale, 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 exhale. Straw in the mouth. Start breathing in. Count. 1, 2, 3, 4, 5, 6, 7, 8, 9. Keep going. 11, 12, 13, 14, 15. How's it going? Hello? How are y'all doing? What number? How many of y'all went to 15? Raise your hand. Y'all went to 15? Really? Really? That's impressive. Okay? So let's try it again. Let's shoot for 18. Here we go. It's going to be tough. Exhale. Straw in the mouth. Go. 1, 2, 3, 4, 5, 6, 7. Keep your shoulders quiet. 9, 10. Don't lift your shoulders. 12, 13. You're cheating. 14, 15, 16, 7. Come on. 18. And relax. How you? That's tough, isn't it? This is an easy, fun exercise because now you have a number. On good days, you may exceed 18, 20, 22. On days that are not so good, maybe a little less. But it's an indicator and an exercise for you to see how well and challenge your lungs. This is one of probably 35 different exercises we do here at the center just for breathing. But this is something we could show at least over the screen and at least make it tangible and something you could take home yourself with. And the cool part is you could do this any time of the day. You're watching TV, at your office, or anywhere. So please, 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 hope this helps. Hope this becomes a tool for you in the future. Other than that, that's our quick lesson today. I'm going to throw it back to Ellen and Sean and proceed forward.
So Mel, very nice presentation. Please thank Coach Harry and Ciro for their comments as well as yourself. I wanted to see if I could open it up to the audience. I have some questions that have been sent in that maybe you could respond to. The first question is, what is the best breathing technique for relaxation?
For relaxation, I will say box breathing. Box breathing is one of those exercises that SWAT teams use before going into a mission. It's used by the police and other organizations to basically relax and focus. You want to see quickly how it goes? Box breathing comes from the fact that you are going to, in equal ratios, you're going to breathe in, hold it, breathe out, and then hold it again. The longer you can do it, or the bigger the ratio, the better the exercise. In other words, if you can breathe in for 3 seconds or 4 seconds, breathe in first, hold it for 3 seconds, breathe out for 3 seconds, hold it out for 3 seconds, and so on. The idea is it puts you behind the wheel. There's so many factors here, so many elements that you have to control that will help to break the anxiety, break that thing that is, causing a mental issue, if you want to say it that way, and puts you in a place where you're in total control of your breathing.
So the next question is, as time goes on, should you be able to take more breaths while using the straw method?
Well, yes. I mean, ultimately, that's the whole idea. It is a progression type of exercise. And the straw is merely an indicator. It gives you a tangible object and matching it with a numerical factor to give you some form of progress or degress on how you're feeling. So to answer your question exactly, yes. The greater you're able to use those techniques, the further you're able to bring that number up.
Awesome. Awesome. Great question from Jerry. He wants to know, can you help post-COVID patients? And what would you recommend?
Yes, we can. And yes, we currently are. We have about a half dozen post-COVID patients that we are currently taking care of. And we're using our full program, which involves all the elements. It involves the ventilatory breathing mechanics that Ciro teaches. It involves a mind-body integration utilizing techniques that we've combined from Qigong, Tai Chi, yoga. And we combine that finally with standard resistance training, i.e. weights, and cardiorespiratory training on our aerobic equipment over here. And we've been pleased to say that we have had positive outcomes with absolutely every client we've brought in here. So yes, we're currently dealing with them. We're happy to deal with them, and we want to help more people.
Awesome. So speaking of training, how can regular exercise benefit breathing?
Good question. Good question. Well, whether you're doing cardiorespiratory training, i.e. aerobic training, or you're doing anaerobic resistance training, lifting weights, when you learn how to breathe properly with the movements, you're going to give yourself more oxygenation. The muscles are going to get stronger. You're going to get better. You're going to have increased cardio response, meaning you can do longer on the treadmill, longer on the bike. You can lift heavier weights for a longer period of time because the two work side by side. The whole cardiopulmonary system, the muscles that require the oxygen to the blood to give them the energy. Yes, they go hand in hand. So the longer you work out, the better you train, the longer you're going to live actually, and the better you're going to be. So I mean, we're full proponents of this.
So I think you've motivated, all of you guys motivated one of our patients. So they've set a goal, and
Yay!
Good, good.
so the question is, they want to be able to walk a city block without coughing or having shortness of breath. What are some of the things that they could do?
Well, coughing, remember, is a natural mechanism of your body, all right? So first of all, we need to understand why you're coughing. Let's display that out there right now. But there are ways and techniques of breathing and ways you can engage with physical activity, pacing yourself, knowing your limitations, and then using breathing and pacing yourself with activity in order to accomplish what you need to do. So it's a combination of, many things here. Sometimes it has to do with medications, sometimes even, the ambience is not the optimal. There are days that I even will suggest to skip, going out there. But yeah, if you know your condition, if you know your normals, all right, applying proper breathing and pacing yourself, that can help a lot.
Progression.
Awesome. Ciro, I think this may be coming your way again, but do you have any recommendation for improving breathing with a deviated nasal septum?
Wow, that's a good one.
We like the challenge. Thank you.
Let me go with that one. So a deviated normal septum, that's an anatomical problem. So it's something within the area of course, of breathing. Now, here's the good part. A lot of times we all learn how to work around that in some weird way or fashion. Now, Ciro mentioned it earlier, by breathing in through the nose and out through the mouth, that is training. So that we'll call it resistance training. I hate to say it that way, but it truly is. It's a natural form of resistance in that airway. The techniques that Ciro was showing earlier of taking that deep breath in and learning how to expand that lower half will help compensate for that blockage or that type of minimization of air. Idealistically, depending on the situation, and why I say that, a lot of times exercise, endurance, or activity like Harry was showing is so extreme, you may have to use both mouth and nose breathe, help compensate for that air intake. Every case is different. That blockage, we don't know how severe it is, but with a proper training, you'll be able to manipulate it to your benefit.
You good? You good?
This may be, that was a good answer. Thank you for doing that. This may fall on the same lines. We have one patient that seems to hold their breath when they're tense. Is there any recommendations that may allow them some good techniques to kind of alter that or stop doing that?
Okay, simple. Don't hold it. It's called ventilation for a purpose. Don't interrupt the process of breathing in and breathing out. What I will suggest is you need to understand where you breathe in, where you breathe out. We make a lot of emphasis on breathing out on the exertion. For example, as Harry just demonstrated a few minutes ago, if you're gonna pick up something, all right, you breathe in first and you bend as you breathe in out. You push as you breathe in out, you pull as you breathe out. So understanding the mechanisms of breathing and combining with proper exhalation on the effort, you never get to interrupt that process,
So quick question. What if one of our guests tonight has pulmonary fibrosis? Any suggestions there?
Well, pulmonary fibrosis, it's very similar in the cases of sarcoid. It is the difficulty of getting air and volume in your lungs. A lot of the exercise that we already talked about today translates well to that type of disorder. At the same time, we still encourage that individual to do the proper testing, the medications as necessary, but the exercise we taught today exactly can help that individual with the exact same way.
And if I may add, there are breathing tools accessible, all right? We're talking about incentive spirometer. We're talking about inspiratory muscle trainers that you can use in order to use the healthy tissue that you have in your lungs and improve it in order for compensate some of the volume capacity you have lost. Yeah.
So you mentioned that spirometer, regularly like the plastic ones given in the hospital surgeries. Talk a little bit more on that. Like share what that means, because some people may not understand exactly what that is.
It is a device that measures how much air you can breathe in, all right? And understanding the nature of pulmonary fibrosis is what we call a restrictive condition, meaning the problem is on the breathing in, not the breathing out, all right? So space is the problem here. Anything that helps you to exercise, first of all, your diaphragm, your accessory muscles, but at the end to make a full expansion of your lungs and keep those lungs as elastic as possible will help you either to slow down the condition or the progression of the problem. In some of the cases, I have to be very honest here, we have seen people actually improving after a spirometry test. we see the FVC and FEV1, improvement of 3, 5, 10% in some cases. So yes, any tool that you can get your hands on that will help you to make a good expansion of it and training those muscles to help that process. Remember, it's not only the diaphragm. We have accessory muscles that helps for that process to happen. Anything that improves those muscles will help.
I want to expand on that though, Sean. This is the incentive spirometer for people who do not know. You've probably seen this in a hospital or something of that nature. It mainly works in a hospital setting to where you breathe in. Believe it or not, we utilize this tool think about it this way. This is weights for your lungs. So we utilize this tool as a form for resistance training, power training, and markers to see and improve on. This is part of a lesson of what we utilize, but we did want to show this for people who do not know what a spirometer is, incentive spirometer is. So great tool.
Now, the sad part is many times they will handle it to you in the hospital and they will not train you how to use it. So I will suggest that you find videos when you can actually learn the proper techniques of using IS. There's elements, if you do it right, then you will be in a good path.
Awesome. Great answer. Thank you. Love the information. So our next question comes from someone that has pulmonary sarcoidosis and fibrosis, but can't qualify for respiratory rehab as a former athlete. This person runs very little, and it seems like their lungs are feeling better and biking. Is this in this person's head, or do you have other cardio ideas that may help that aren't so hard on the joints?
Well, okay, that's going to be a twofold question. Right. So I want to go back to the pulmonary rehabilitation. Yes, you're right. For a true pulmonary rehabilitation, the majority of pulmonary rehabs only accept people with COPD or emphysema, sadly enough. Now, there are other areas and other ways you could get into pulmonary rehabs. Again, talk to your physician about those possible angles. Otherwise, when you're talking about exercise along that nature, yes, do not let just know that there are so many other things you can do to help you with that cardiac conditioning. That's what we really pride ourselves on. One thing that we want to stress, and Harry's probably going to go over it, there are a lot of things that you can do on a daily basis, even small, but you got to work on duration, time, and resistance. So any exercise that you can do and this could be walking, this could be cleaning, this could be vacuuming. I know that everybody hates to vacuum, but I'm just saying there are things that you do on a daily basis in your everyday walk. You could make it into an exercise. I'm gonna pass it over to Harry.
Thank you, Mel. I'll be brief. So we have the usual cardio equipment here: treadmill, spin bike, elliptical. We take our clients outside, we put the parachutes on, and we have them run with resistance bands. But being a former athlete, then you'll understand, in addition to those things, depending on the severity of your fibrosis and your sarcoidosis, we also teach internal Asian meditative techniques, i.e. Tai Chi, Qigong. We could show you routines. We could show you simple techniques that you could go ahead and repeat throughout the whole day using the proper breathing with the corresponding body mechanics, and you'll get that cardio style workout. Over time, you'll increase your lung capacity. Again, we've had nothing but positive outcomes. We can discuss more about that.
There are options.
Yeah, there are options, and we'd love to be able to assist with that. So good luck to you. Hang in there. I mean, nothing but respect for you.
Awesome. Thank you for your offer to help also. I have a good friend out there that wants to know he can't breathe in as long as he can exhale. And he wants to know, what does that mean? This was always the case, even when his PFT and FVC1 is near normal. I hope you guys know what those are.
We do.
They were normal since he developed sarcoid in 2005.
Okay. Those two numbers, FVC, it has to do with volume capacity. The other one, FEV1, it has to do with the flow. Two important components of your breathing. All right. One, it's space. The other one is how easy it goes in and out. If I understood the question, he has a problem breathing out. All right. that will put it in the family.
No, it's breathing in, right?
Breathing in.
Right. So he
Breathing
wants
in.
to know why can't he breathe in as long as he can exhale?
It can be a restrictive issue that we see in here, but also it could be obstructive. If you're trapping air, it will be very, very difficult to breathe in on top of it. Let me put an example, COPD, all right? COPD, it's a problem when you start trapping air. Think about your alveoli all the way inside your lungs, those little balloons that we have, instead of nice balloons that can expand and then recoil as you breathe out, think about an inflammation process that will affect it and convert them into paper bags. So when you breathe in, there's limitation, but there's no recoil, all right? COPD can feel, for those that don't understand the concept, think about this, breathe a little bit, hold it right there and try to breathe on top of it. Since you cannot empty your lungs, you know, the inhalation is very restricted because you already have full lungs, all right? So again, in a case like that, we will run a test. Number one, we need to understand better the numbers too, so we can plan accordingly based on what we see with the numbers, if it's restrictive or obstructive.
Well, in that one particular case, though, Sean, what you just said, Cyril brought up some very good points. He had a rough FVC, but his FEV1s and everything else was normal, right? So remember, and again, this is for everybody, and I'm sure everybody knows this, a lot of times with sarcoid, it's mainly a restrictive disease. So it's the inability to get air in your lungs. So just to match what you were saying, that may just be the course of the problem right now. Now, here's the neat part. A lot of things, it does not mean that you cannot further expand the lungs. A lot of times we get so stuck that we sit there and we limit ourselves by not challenging it. Remember, muscles have the ability to expand. Tissues have the ability to expand, but you have to challenge them. That's the reason why when we're doing the straw technique is to count as far as you can go numerically to challenge your lungs to go through that deep, deep inhalation.
Very good. Very good. Thank you very much. Thank you. I appreciate that. Our next question comes from a patient that has a diaphragm issue. And this person is looking for techniques to help with that issue called ED. I don't know who Ed is.
Oh, is that his name?
No. Are there diaphragm issues called ED?
It may be a term that we may not use. It may be it may be an acronym.
Yeah. So I think I could frame the question. This person has a diaphragm issue, and are there additional techniques that this person could use to combat that?
Okay. Imagine the diaphragmatic breathing that we were talking about. The standard version of it will be sitting down. But imagine diaphragmatic breathing done in a laying down position. All right. This is a neat part. You can use anything you can find around your house that weighs anywhere from 10 to 25 pounds. Put it on top of your diaphragm muscle. And as you breathe in, you're going to push up as far as you can. Why this is important? Because by applying the weight, you can feel exactly certain points. And you're going to start using your muscles in order to push that particular spot. That will teach you coordination and manipulation of the diaphragm muscle. On top of it, the resistance, the weight, it's like lifting weights with your diaphragm muscle. So at the same time that you are increasing power and strength, elasticity, you're also improving control over the manipulation of your diaphragm muscle. Remember, the more the diaphragm moves, the more air comes in.
I think ED stands for eventration of the diaphragm.
Okay. Yeah. Still same process. Whatever what you said is still the exact same thing.
Yeah,
but
that's what I thought. Nailed it though. Thank you very much. So we all live in different parts of the country and have to deal with the elements of weather out there. Is there anything that we need to do in the area dealing with summers and humidity?
Okay, so being in Houston, we're very familiar with summers and humidity. 100 degrees, 100% humidity is the average. I remember when we had to wear suits to work, it was terrible. Thank goodness this is our suit now. So with anything else, dehydration is going to be it's going to be the biggest challenge you're going to face. And when you get dehydrated, when your throat gets dry, it's hard to breathe, it's hard to exhale, it's hard to exercise. Follow the same rules that we do with any apparently healthy client that's training, is we maintain proper hydration, maybe slow down a little bit when doing outside exertion, take a little bit longer in between take a little bit longer rest periods. And the moment you start feeling like you're uncomfortable, get yourself into a place and relax. Most of us, we're no longer performance athletes if we ever were. So we're not out to prove anything. Go out there, exercise. When you get too hot, get inside where it's cooler. Stay hydrated.
And go ahead.
Understand your triggers that cause shortness of breath. It is not limited to temperature. Sometimes pollen levels will be high. Ozone can affect also our breathing. If you find yourself in a position or in a place where you know your triggers have been turned on, remove yourself from there.
Another big thing is energy conservation. I mean, a lot of times we're rushing from point A to point B all the time. It's whether it be a lifestyle, whether because I can't breathe, I need to get there as quick as I can. You have got to learn how to use your energy conservation to breathe more at a pace level. Use the diaphragmatic breathing and exercise conditioning that we were talking about, and lengthen and pace yourself through from point A to point B. That is a practice. That's something that's not innate. You're going to have to learn how to slow down a little bit.
Wow. Very good advice. I think you're motivating quite a few people in attendance. And the next question is really looking for routine exercises to maintain good, healthy breathing when you're not in crisis.
Okay, so maybe Ciro can address part of it, but as far as the physical part, so if you're apparently healthy, if you have your doctor's clearance to go ahead and do resistance exercise, when I train a client that wants to be able to breathe better, I use large multi-joint movements that uses the entire larger muscle groups. I'll have you do wide grip bench presses with light weight. We're not here to become Mr. Universes or Mr. Olympias, although there was a time. Wide exercises, wide grip benching. I'd have you do low cable rows, wide grip pull downs, squats and deadlifts, not with a lot of weight, but it's a multi-compound, multi-joint motion, making the body have to utilize the full breath because your whole body's being under tension. And more importantly, these techniques open up the chest cavity, allowing your lungs to expand. That combined with the proper diaphragmatic breathing technique, you'll find measurable improvements.
Dito.
And remember to preload. We preach that. That is something that we do here. We have to. That's because that is, again, another lifestyle change, is to preload to everything.
So my good friend Nancy wanted me to share with you, we were just talking about humidity. Nancy says that she had to push some snow out of the way in Minnesota today.
That's not quite humid.
Got friends in Minnesota. They kind of laugh at our situation we had here in Texas because to them that's nothing. She said she had 7 or 8 feet of snow out of her house the next morning. Good for them. Good for their infrastructure. So,
but Nancy, whenever you're pushing the snow, remember to breathe.
There you go. Scoop, exhale. I'll tell you what. That's a heck of a full body workout. I respect you for that. But yes, don't hold your breath. Exhale on the exertion, and all funny aside. Yes. Scoop, exhale as you toss over your shoulder. So you can have your snow. We love the cold, but not
that much.
Not that much.
No.
Yeah.
I'm sure a snowblower would help things.
Yeah.
All right, let's see if we can find another question. All right. Okay, so does not taking deep breaths always mean pulmonary fibrosis? If so, does it indicate that it is progressing?
Not all the time. We call it breathing retraining for a reason. Okay, most of people out there, they don't keep a good diaphragmatic technique. It's not taught. Think about the babies, newborns sleeping on their crib, facing up, and that beautiful belly going up and down, up and down. At some point, we have forgotten to do so. We don't use our diaphragm to breathe and keep good ventilation. We have replaced it by breathing with the shoulders and trying to pop the chest, as I was showing at the beginning. So by breathing retraining, we can correct a lot of those issues just by changing a little bit and tweaking the way that you breathe.
Tell everyone a little bit more about your practice. I'll share some things on the screen and you guys can maybe let everybody know about some of the other exciting things you're doing, how to get connected with you if they wanted to research and get some more information. How best would they do that?
Well, again, our programs, like it says there, it really is designed. What you saw was only a smidget of what we teach. We have fun doing this. We're not acting. We really do have fun in our one-on-one training sessions. So if you want to really learn to breathe better, get stronger, and just improve your quality of life, reach out to us. And you see our contact information there. Our website is www.breathe-fitness.com. Our email is team@breathe-fitness.com. I think also, please feel free to call and text us if you wish. Our phone number is not on there, and that's my fault. Our phone number is 713-487-9811. And I encourage you, that's with us all the time. If you have any questions or anything, text us.
Call, text, yep.
Yep, we will be happy to answer. The neat part is, we thank you to Ellen and Sean both. We really, really want to continue working with each one of you. We have a one-on-one video training where we do this, but in more in detail and in more fun and in 45-minute sessions. Normally we charge $50 an hour. For you guys, it'll only be $30, and it's going to be fun-packed for you guys to really learn how to breathe better.
You get training from all three of us in that time period. So let us help you. We'd love to. The video portal.
And that's the neat part. And Harry just brought that up. Probably within the next month, we're also going to have a membership video portal. This is something where we're going to have probably anywhere from 50 to 100 videos with all of them probably only 2 minutes long. But they're all short, sweet, concise educational pieces, from breathing to exercise and everything in between, to help people just live better.
It's very affordable too, and very accessible.
Well, Mel, Ciro, and Harry, I want to thank you from the bottom of my heart for you guys participating and partnering with this experience. To be able to deliver to this community that I care so much about is very, very important to me. To be able to continue to do that, bring this timely information. I want to also thank Ellen, who's my right arm. Ellen is a sarcoid patient also, who has really done an exceptional job at helping us with the foundation. I'm going to ask Ellen to come on now and let you guys know how we plan to share this information in a replay fashion. So in case you weren't able to grab all of the exercises like Eddie, then we're going to make sure we can do that on replay. Ellen?
Hi, everybody. So if you've registered for tonight, we have your email address. Tomorrow, everyone is going to get an email with information on BreatheFit, how to get in touch with them, their website, everything. So if you don't have a paper or pencil handy, do not worry. You're going to get that in your email tomorrow. If you don't see it, please check your junk or your spam folder because it might be in there. We're also going to be working on getting additional video content out there to everyone and breathing exercises. So just, if you want to follow Life and Breath on Facebook, on Instagram, you can see, the content as it comes out. Also, we do these sessions the second Thursday of every month. We do webinars focused on sarcoidosis the second Thursday of every month at 7 p.m. So again, follow Life and Breath on Facebook or Instagram to see what our next session is, how to register, and go from there. And on our website, www.lifeandbreath.org, we also have all of our previous webinars posted on there. So we have everything from nutrition, supplements, dealing with COVID, and, information about the vaccine for sarcoidosis patients. So it's all there, and I'm going to outline that all in an email to you guys tomorrow. So just be on the lookout for it. And thanks everybody for joining.
Thank you, everybody.
One of the things we wanted to do is to make sure you understand that you're not by yourself. You have a community that'll support you. Life and Breath Foundation is there also. Please stay in touch and visit us. And again, to Mel and the Breathe Fitness guys, thank you so much for making a significant impact with us this evening, and we appreciate it.
It was an honor and a pleasure for us to be here. And if you don't mind,
And remember,
don't just breathe, breathe fit.
There you go. There you go.
Good night, everybody. Take care.
Good night,
God bless.
everybody. Be safe. Stay healthy.